disorder where children have trouble carrying out all of the complex sequence movements that are required for speech. You might have heard of a term dyspraxia before, which is still used for other forms of dyspraxia or apraxia, but when it comes to speech pathologists now always use the term apraxia of speech. So let's talk about how we make sounds in our mouth. A lot of people may think it's just about structure, it's just about anatomy. I've got a tongue, I've got lips, I've got teeth, I've got breath that I can use to make each sound. But the actual articulators or the structural parts of your mouth that you use to speak are only one part of a 12-part process from hearing sound to being able to make sounds. So let's step it through a little bit. I'm not going to take you through all 12, but the thing about children with apraxia is that most of them will actually already know what the message is that they want to say. They have language. They have full sentences in their head that they want to say. But it's actually a breakdown in a different part of their speech system that is stopping them from being able to get those words out. So if we think about it, they've got an idea. They know what they want to say. They then need to create the strings of sounds and words that are needed to say that idea. From there, they need a movement plan. They need to know for each sound what movement needs to happen in their mouth to be able to say each sound. But the other plan that needs to go in there is not just what needs to move, but how much and how fast and what timing does it need in collaboration with the other sounds. They need to be able to move from one sound to another sound. They then need to transmit that information, that plan of what everything needs to do, to the muscles or to the structures and articulators. And then the articulators and structures need to be able to say those sounds. So the thing about this is I just gave you 5 key steps, and these happen lightning fast, so quickly. And if there's a breakdown, you can see that we as adults who are adequate speakers are able to just say the sounds, say the words, say full sentences, speak in long conversations, talk all day if we have to. So this process is happening all day long without us even actually thinking about it. So the thing about apraxia is that it's happening in their brain. Children with apraxia are having difficulty creating or transmitting or storing the information or the motor plans, motor programs, and the sounds that are needed to string all together in a sequence. So, what does it actually sound like? Now, we actually know that there are some early signs that we might see in our babies and toddlers that could give an indication that a child has apraxia of speech. That is not to say that these presentations that I'm going to tell you mean that your child is definitely going to have apraxia. That's not the case. But these are some early signs that could warrant you going to see a speech pathologist so that you can get started really early, because early intervention is so important. Okay, so one of the key early signs is that they have a lack of consonants as a baby. In particular, that they don't even have one consonant by the time they are 12 months old. Now, the thing is, if you can't remember what a consonant is, we have consonants and vowels. So the vowels are things like a, e, o, and the consonants are all of the others, b, k, t, d, all of those sounds that go around the vowels. So if your baby doesn't have any consonant sounds in their babble in words at all, and they're only making vowel sounds, and then this then continues up until 18 months old, this is a warning sign for speech pathologists, and we'd really like to see children if they aren't developing any kind of consonant sounds. Now, when they are 17 to 24 months, if a child has less than 5 consonants, then we are concerned. And if they don't have many syllable structures and they're just using vowels. So what I mean by a syllable is something like ba. I've got a b and an sound. But if they're just using lots of vowels, like just just e, and not actually able to put them into syllables in combinations, then that is another early sign for us. We may also see disordered babble, and I'm sure you can understand that if your child doesn't have many consonants, we're not getting much babble happening, because the babble is consisting mostly of those vowel sounds or even noises that don't sound like speech. As children get older and they do start to say more words, there are many different things that could indicate that a child has apraxia of speech. The best placed person to make a diagnosis is a speech pathologist, because we have the training and the expertise to look at the entire process of speech perception and production and work out what part of that process is breaking down. There are 3 really key indicators for children that have apraxia of speech. And again, these are not definite. Your child may have these 3 indicators and not have apraxia of speech, but these 3 in particular are the ones that we tend to see in most children with apraxia of speech. Number 1 is difficulty with multisyllabic words. So multisyllabic words have more than one clap. If that's how you learn to do syllables as a kid, they might add syllables, delete syllables, jumble them up, or use the wrong sounds. We also see voicing issues. So if you have a feel of your voice box, which is here, and if you're just listening in, have a feel of where you think your voice box is. And as you're talking, you should hear it vibrate as if there's a little buzzy bee in there. And that's what I like to say to my kids as well. And there are some sounds that don't have your voice switched on, and there are some sounds that do. And we need to be able to very quickly switch on our voice and switch it off. If we consider the word pat, the p sound has no voicing, the a sound has voicing, and the t sound has no voicing. So we go off, on, off. That's a very complex thing that needs to happen very quickly. So a child with apraxia of speech will often have difficulty with that voicing that needs to happen, quickly switching it off and on in very quick sequences. And the third one is stress within the words. So it's not about how stressed they are, and yes, they may be feeling quite stressed or quite frustrated because they can't get their messages out, but what I'm referring to is actually the stress inside words. So for example, when I say, let's say I say pineapple, I put quite a lot of stress on that first pineapple. And if I move that stress into a different position in the word, it sounds a bit strange. So if I do pineapple, it's the wrong stress within that word. And so all of the words that we speak have stress in all different places. And we also change our voice quite a lot to do things like ask a question or give a command and tell someone to do something. And of course, when you really think about it, all of these are about that sequencing that's happening. We need to be able to put together lots and lots of different sequenced movements. So I hope that this gives you a really good overview of what apraxia of speech might look like. Now, the thing about therapy is that a child who has apraxia of speech and is seeing a speech pathologist will need a lot of support from you as a parent or as a caregiver or a grandparent or a friend, because it requires quite intensive therapy. The length of how long you see the speech pathologist for is going to differ quite greatly. If I just quickly go back to the symptoms or the characteristics of apraxia of speech, it can present quite differently in different children. So it doesn't necessarily sound exactly the same in all the kids that we see, and there are different severities as well. So it's really hard to predict how long you'll be in therapy for if your child has apraxia of speech. Some children may even need what we call AAC, or augmentative and alternative communication, and that is things like signing or having picture cards or some sort of device that helps to replace the speech that they don't yet have. So they can still communicate with you, they can still tell you their amazing messages, their amazing things that they want to say, because the language and the information is inside them, but the apraxia of speech is restricting their words out clearly. And therefore it's really taking away that power of communication, or that gift of communication. So I hope this gives you a really, really good quick overview of what is apraxia of speech. And if you have any questions, as always, please feel free to get in touch with me. And I look forward to talking to you next time.